Heart failure accounts for over 18% of all medically certified deaths in 2022, totaling more than 95,000 individuals. Despite its prevalence, it remains misunderstood and often grouped with other cardiac issues. To mark World Heart Day this month, we speak to Dr. Raja Ezman Faridz Raja Shariff, who is a consultant cardiologist from UiTM, about the symptoms to look out for.
Heart attack normally describes a condition where a patient develops a blockage in one of the arteries or one of the blood vessels in the heart, and then that causes what we call heart attack or myocardial infarction when it comes to when you talk about it in jargon language. Heart failure, on the other hand, is when the heart pump of the heart doesn't work effectively. So it's either the pump itself, it doesn't sort of forcefully pump and sort of delivers blood across the body, or if the pump itself is struggling to pump because of external forces, so there's a lot of pressure build-up, etc. And normally then patients develop symptoms that are suggestive of heart failure, such as shortness of breath or difficulty walking distances because of that, because they're unable to catch their breath, or walking upstairs because it takes a lot more effort, or even problems with sleeping because they're lying sort of horizontally. So gravity and all that, they start developing water in their lungs and they feel breathless, or they can develop water in their peripheries or their legs because of gravity as well, and they get leg swelling. So that is more pathognomonic or more suggestive of heart failure.
Dr. Ezman explained that since heart failure occurs more gradually, many fail to notice the early signs.
With heart failure, most of the time, you're quite lucky because it can be insidious. So it takes a while, it's a bit more gradual when it develops. But I think what happens is patients aren't very forthcoming with their symptoms when it comes to heart failure. So they actually seek medical attention far later. And I think the truth is, when it comes to diagnosing heart failure and getting the diagnosis right, most of the time it happens in a hospital setting. So patients are already breathless, requiring oxygen, etc. When actually it could be detected far earlier, much more quicker in the community setting outside of the hospital.
With any heart diseases, Dr. Ezman emphasized that prevention is always better than cure.
Patients at risk are often those who have this conglomerate of comorbidities, and just trying to get them in check and not getting them in the first place is key, really. So checking, making sure you're not at risk of diabetes, getting your yearly checks, blood tests, etc., urine tests to make sure you're not developing the disease, healthy lifestyle, diet, exercise, etc., as well as a given, and sort of keeping your weight in check. Sometimes, aging is difficult. I think aging is something that you can't control per se, but even at an elderly age, there are things that you can do to still maintain good heart health. We've shown again time and time, exercise is an investment not for now, exercise is an investment for later. And we have shown that exercising at a younger age does prevent the development of heart failure with preserved ejection in the future. So again, simple advice that probably everyone has heard day in and day out, but sort of really taking them into account and actually doing them.